Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former compensation and pension examiner. Today, I want to come on and discuss anterior cruciate ligament or ACL tears and how they can be related to VA disability. So let's first jump in and talk about what an ACL tear is. So I have my knee model here, and I want to discuss some of the anatomy so you guys can get a better understanding. All right. So these bones here, this is going to be your thigh bone, also known as your femur bone. Okay. And down here we have the tibia, and this is the fibula or the lower leg bones. Running across the top here, we have the quadriceps tendon. So your quadriceps muscle is up here, running over the patella, and that would be considered the patellar tendon here. Behind that, you have your patella or your kneecap. And then we have the lateral collateral ligament over here and the medial collateral ligament over on this side, okay? So I'm going to pull this away here, and we're going to look at the underside of the knee. So this is going to be your meniscus. So we have your medial meniscus and your lateral meniscus. And then in here is your ACL. These two, this is your ACL here. And then on the back side is your posterior cruciate ligament, or your PCL. So your ACL and your PCL. And what do those ligaments do? So those four ligaments really help to keep the knee stable in the joint. And the meniscus also helps with stability, okay? So imagine if one of these ligaments is out, like if this one is out, you're going to have a lot of instability in the way that the knee joint moves, okay? Now it can be sprained, it can be strained, it can be partially torn, it can be completely ruptured or torn. And there's different ways that that can happen. So for veterans, it can happen on a primary basis or a direct basis. So for service connection, so if you were on active duty and you had a bad jump, maybe you're a paratrooper, maybe you were playing football for PT and you get hit from the sides like Adrian Peterson did, right? Adrian Peterson got hit from the side and he had what's called a terrible triad where he injured his MCL, his medial meniscus, and his ACL. So any variety of things that happened while in active duty, maybe it ruptured or it tore and you've had chronic pain and trouble since, you may be service connected for that, or you can have it on a secondary basis related to another condition. So it doesn't have to necessarily be a traumatic rupture. You can have some chronic wear and tear or some instability from another part of your knee that causes that degeneration and that wear and tear over time. So I want to discuss some of the literature that I use in a few reports that I have written. And this may be helpful for you to discuss with your primary care provider, your orthopedic provider, to see if they're willing to help you and support an opinion for your knee injury related to your service. Okay. Also with those occupational hazards, right? So we've done videos on infantry guys. We've done videos on paratroopers. Did you have a really bad wear and tear on your knee over time that caused a lot of degeneration and different just junk in your knee? So let's see. The first article that I'd like to share with you is one from Stat Pearls on anterior cruciate ligament injuries, last updated in 2021. Says one of the most common knee injuries is an ACL sprain or tear. Typically, injury occurs during activity and sports that include sudden changes in the direction of movement, rapid stopping, jumping, and landing abnormally, a direct blow to the lateral aspect of the knee, or slowing down while running. It also goes on to note that most of these are diagnosed via MRI. It can be diagnosed clinically by physical exam, but most of the time it's done by MRI. It can also be diagnosed in surgery if they're scoping your knee and they notice that it's ruptured. So another article explains complications of chronic ACL tears that have not been properly treated. An article titled Fate of the Untreated Anterior Cruciate Ligament Injured Knee, published in 2017, explains that patients with pain and swelling may have had meniscal tears and that have not been repaired. It's possible, though not substantiated, that meniscal tears themselves may contribute to different changes just due to that instability, like we talked about. So it's also well known throughout the orthopedic community that a change to an individual's natural gait will precipitate pain and dysfunction in the feet, in the knees, and the lower extremity joints. An alteration to one's natural ambulation also has been known to cause abnormal pronation, contributing to excess foot mobility, leading to inflammation of the tendons. So just some of that information on that kinetic chain theory that we talk about in some of our other videos, that one joint is connected to another joint and can throw off and disrupt the normal rhythm of how that joint is supposed to work. Okay. So I hope this was helpful. Please drop some comments if you guys have any questions. I have a few more articles here, but I won't go on and on about them. Hopefully those will be helpful to you, and follow up with your doc. If you have any questions about the claims filing or strategy process, it's always beneficial to follow up with an accredited claims agent, attorney, or VSO. You can search them out on VA.gov. There's a great tool to help you find somebody to assist you with that. I hope this was helpful. Please drop some comments. And as always, thank you for watching.